What is rehab or rehabilitation? My name is Fred Begaris, a board-certified sports and spine medicine physician in Virginia Beach, Virginia. After 10 years of practice, I still find musculoskeletal medicine both fascinating and challenging. This podcast is about the lingering thoughts and questions I've had after residency and fellowship. My hope is to spark discussion, challenge dogma, and share my experiences in musculoskeletal medicine. Welcome to the Talking Rehab Podcast. As a young child, I was pretty much told that I was going to be a physician. As the son or only child of Asian immigrant parents, of course, stereotypically they wanted me to become a physician. I always thought it was a very noble profession. I liked helping people, so I never really questioned it. It seemed to make sense. My first real experience in the medical field was when I took sports medicine in high school. I had the opportunity to work in the training room and also be on the field, and I really enjoyed it. So it seemed to check off all the boxes. I had some confirmation that I was on the right path. When I entered college, I majored in biology and was pre-med. I didn't really know what else to actually try, but I just knew that biology and pre-med was the typical way to get into medicine. But as you should in college, I started asking more questions, and I started to wonder whether or not I wanted to go to medical school for myself or for my parents. So I started searching around and looked at other fields: chiropractic medicine, pharmacy school, PA programs, physical therapy. And I always knew I liked sports medicine. I liked working with my hands. So I started shadowing in a PT clinic, and it was a great experience. I was working essentially as a PTA, but I had a full-time school load in addition to part-time work schedule, and I would volunteer in this physical therapy clinic. I really enjoyed my time, and I started looking into the prerequisites with a PT program at the time. It was still a master's, and there were some doctoral programs, but I started shadowing out, and I started looking to take the GRE. Towards the end of my sophomore year, I was very, very interested in PT and was almost 100% positive that this was the direction that I was going to go in. And I happened to go out to California to meet with some friends and family. I set a meet and greet with a professor at USC. Unfortunately, I don't remember who it was, but they were nice enough to talk with me. We exchanged some emails, so I just thought it'd be nice to do a face-to-face. And after about a 30 to 60-minute conversation, and I was maybe 20 years old at the time, they concluded that I should probably look into medical programs versus PT. And that really kind of threw me for a loop because I was very gung-ho PT all the way through. And for them to know me for just an hour, they said, I don't think you're a good fit for PT and maybe a medical program. But what I learned working in physical therapy clinics was I spent a lot of time working with the typical post-op patients in addition to knee pain, back pain type patients. What I noticed is that a lot of people got better and then some people didn't. Some folks progressed faster than others, and that made me very curious as to why this person would progress faster than the other. And it never really seemed to always make sense to me. It was never a particular factor that I could isolate that would predict someone's outcome. In my mind, I always felt like that there was something missing. From a medical standpoint, these patients have seen an orthopedic surgeon. They did conservative treatment, and some got better, some didn't. So that to me was the medical aspect of things. And then even after surgery, they did physical therapy. And again, a lot of people got better, but some people didn't. So the people who didn't progress really caught my attention. And I was thinking, well, is there something that's missing? So I started looking at chiropractic field, and I really actually liked it in terms of learning manual medicine and the general philosophy of structure and function. But at the same time, I also knew that I had a lot of questions that I could only really answer through medical training. And it didn't make sense to me at the time to go through a medical route, because if at the end, if I was only going to learn what an allopathic physician knows and I'm seeing the outcomes in real time, I wanted more than that. So, it was probably a little naive. It did drive my decision. I was like, okay, clearly this particular route of just a straight medical training yields a certain type of outcome, and I wanted more than that. So, but at the same time, I also realized that a pure chiropractic route, I wouldn't necessarily understand the medical aspect of things. I was very interested in the imaging and the pathophysiology, things like that. Fortunately, I had the opportunity to learn about osteopathic medicine through my cousin, who might have been a early family medicine resident at the time. And after talking with him, it definitely piqued my interest. There weren't a ton of schools at the time. When I was applying, there might have been less than 25 in the country. It's obviously very different now, but I had to learn about osteopathic medicine from word of mouth and essentially snail mail, just trying to figure out what the field was about. There was a book that I read, and that was about it. This is obviously before social media, and even the internet at that point in time was really still taking off. So the information was quite limited. But we're now probably into my junior year of school. I was still really on the fence, and I was thinking I'm just going to go pre-PT, continue on with physical therapy, despite those feelings. But at that point, I felt like I had done my due diligence, and I was going to commit to going to PT school. But then I was studying for finals in my senior year. This is the first semester, and I just all of a sudden just kind of looked up from my books, and it just kind of hit me like a ton of bricks that I wanted to go to medical school. And it was great because once I came to that realization on my own, I never really looked back. So, the decision at that point was going to an osteopathic program versus an allopathic program. And, obviously there's some other things to consider, out of state, things like that, but that really wasn't on my radar. What drew me away from the allopathic program or curriculum is it's very disease focused, which obviously you have to learn. That's a big part of medical education. But what I really enjoyed about the osteopathic approach is that it really starts with health. From a manual medicine standpoint, the presumption is that the body has the ability to heal itself if put in the ideal circumstance. In osteopathic sense, a lot of it is focused on symmetry and alignment of the spine and the surrounding extremities. And that really resonated with me, especially coming from an orthopedic background. That wasn't really the focus of acute injuries or subacute injuries. So I really believe that maybe this was the missing piece. And something else that drew me to the field was the direct hands-on approach. With medical school, the first 2 years, obviously a lot of didactic training, a lot of studying, but with osteopathic medical schools, you have complete hands-on approach from day one. And that was very appealing to me because, studying something, but moving something and laying hands and gaining that tactile appreciation is just something that can't be replicated. Particularly at this point in time where everything is online and everything is virtual. I think an osteopathic approach is another way to connect to people. And that connection, the sooner you establish that as a younger medical student, the better, because it is just way too easy to get disconnected, with, again, just the times are different. Again, I went to medical school in the early 2000s, so times have definitely changed. And I really believe that an osteopathic approach is the most direct way to stay connected to people. We can go into, debate and the research of the effectiveness of osteopathic manipulation, so on and so forth. But at the end of the day, people feel better. I mean, some people do, some people don't, but there is obviously some sort of therapeutic benefit that people appreciate. Of I'll go into maybe that in a different episode of my thoughts specifically about manipulation techniques, but there definitely is a difference. I would say a large majority of my patients that had manipulation, whether it's chiropractic, massage, or an osteopathic approach, they feel better. They can tell that things are different. And I don't think research will ever talk to you that way. Point is that osteopathic medicine wasn't something that I sought out on my own. Growing up, there was definitely osteopathic physicians around me, but I never really influenced them. I didn't really know that there was a difference in the very, very beginning, to be honest. But it really stemmed from the fact that I felt like something was missing. And if I hadn't felt that way, I don't know if I would have looked at a different path aside from the traditional allopathic or MD route. And I'm very fortunate that I listened to myself and my gut, because I still feel that way to this day. If I had not come from an osteopathic background, I probably wouldn't have found physiatry or PM&R so appealing. I'm very, very proud osteopathic physician. I encourage anybody who's interested in the field, whether or not you're going to go into sports medicine, to strongly consider this very valuable education system. And I think that that type of education is invaluable. It's not something that you can learn online. You can read about it, but to have the hands-on approach as a student, I think, is invaluable. I appreciate you guys listening to this particular talk. If you guys have any questions, make sure you know where to find me. Have a great day. Thank you for listening to the Talking Rehab Podcast. I hope that this podcast stimulates you to question your own practice and how you approach rehabilitation. I truly appreciate your time and attention. If you enjoyed listening, make sure to like and subscribe to the podcast. I wish you a movement-filled day. Take care.